When you think of cupping, you probably picture those iconic circular marks, right? But what if I told you that behind those marks, there's this systematic, clinical framework, one that treats your body like a single interconnected map? Well, today, that's the map we're going to explore. Okay, so let's just jump right in with the big question. Is cupping just an ancient art, a tradition passed down through the ages, or can it be a modern clinical science? The framework we're looking at today, which was developed by Dr. Ali Al-Jamal, doesn't just argue that it can be a science, it actually lays out the blueprint for it. It's all about building a bridge between that ancient wisdom and what we know about contemporary physiology. So, first things first, we have to completely reimagine the approach. This whole thing starts with a foundational concept that really changes everything. We're moving way, way beyond just sticking cups on a sore muscle. And that concept is called holoregional dysfunction, or HRD for short. Now, I know, it sounds super complex, but the idea behind it is actually pretty simple and really powerful. It's about seeing the body not as a bunch of separate parts, but as one integrated system. The outside, our muscles, our skeleton, is deeply connected to the inside, our internal organs, all through the shared network of nerves and vessels. This right here, this gets to the very heart of it. There's this thing called the viscerosomatic reflex, which means that problems with our internal organs can literally show up on our skin and in our muscles. So for example, a problem with your liver might actually show up as nagging pain in your right shoulder. It's like our skin becomes a mirror, reflecting what's truly going on inside. And that leads to this huge shift in perspective. You can see it here. The traditional view might just see that shoulder pain and, well, treat the shoulder. Simple enough. But the HRD framework asks a different question. It asks, what is this pain telling us? It's about finding the source of the fire, not just spending all your time fanning away the smoke. So, if the body is sending out all these signals from the inside out, how does a practitioner actually, read them? How do they decipher the message? Well, that's where a set of 5 diagnostic keys comes into play. Think of the practitioner as a kind of detective, on the hunt for 5 specific clues. This is their checklist, a systematic way to uncover exactly what the body is trying to communicate. And here they are, the 5 keys. First, the practitioner is looking for any sensory changes, things like a weird burning sensation or an area that's super sensitive to the touch. Next, they're feeling for tissue texture changes, and we're going to come right back to that one. They look for any asymmetry in your posture. They check for any restriction of motion. And then the final crucial key, they connect all of these external signs back to potential visceral involvement. In other words, an internal organ. Okay, let's zoom in on tissue texture changes because this part is absolutely fascinating. This isn't some vague, this feels off kind of thing. No, practitioners are trained to feel for very, very specific qualities. This quote here just illustrates the incredible level of detail. They're literally feeling for tissues that are boggy, like a swamp, ropey, like a cord, or even doughy. Each one of those textures tells a completely different story about what's happening underneath. Now, once a dysfunction is found using those 5 keys, the next critical step is to classify it. Is this a brand new problem that just popped up, or is it something that's been simmering for a while? Making that distinction is absolutely critical because it changes the entire game plan for treatment. In this table, this is basically the clinical roadmap for making that call. I mean, just look at the stark differences. Over on the left, you've got an acute or recent issue. That brings sharp pain, warm, red skin, and tissues that are described as boggy. Now look over to the right. A chronic, long-term condition, that's more of a dull, achy pain with cool, pale skin, and those tissues now feel doughy or fibrotic. It tells the practitioner a whole story about the problem's history before the patient even says a word. So how does a practitioner pull all this information together accurately and reliably? It's definitely not guesswork. They follow a very structured, multi-phase examination to make sure the diagnosis is both thorough and repeatable. And the protocol just flows so logically, from the general to the very specific. It kicks off with observation, just looking at posture, skin, that sort of thing. Then it moves into function by analyzing movement. Phase 3 is that hands-on palpation we just talked about, feeling for those critical tissue textures. And finally, it all narrows down to a precise segmental diagnosis, pinpointing the exact level of the spine or the dysfunction is coming from. And the ultimate goal of this entire systematic process, the whole reason for doing it, it's to answer one single critical question. Is this just a muscle or a joint problem, a body wall issue? Or is it a reflex, a sign that's pointing to a deeper internal organ issue? Getting this right is absolutely everything. It's the key to an effective, targeted treatment. So, as we start to wrap this up, it's pretty clear that the holoregional dysfunction framework isn't about throwing out tradition. Not at all. It's about enriching it. It's about giving it a robust scientific language and a systematic clinical method to really understand what our bodies are trying to tell us. It truly is a bridge, one built from anatomy, neurology, and physiology. And that really just leaves us with one final thought to chew on. If our own skin and muscles can act as a kind of mirror for our internal health, could a framework like this change not just how practitioners work, but how all of us listen to and maybe finally understand our own body's signals?